Well, good afternoon, good morning to those on the West Coast, and welcome to today's webcast on participating in the 2022 CAHPS Home and Community-Based Services, or HCBS CAHPS Survey Database, What You Need to Know. My name is Dale Schaller, and I'll be moderating today's session presented by the Agency for Healthcare Research and Quality, or AHRQ's CAHPS User Network. Next slide, please. We have just a few housekeepings to cover quickly before we get started. The first has to do with audio issues. And if you have any trouble with your computer audio, you can connect to the webcast audio using your phone by clicking on phone call and finding the dial-in number and meeting ID. Or you can select call me and then enter your phone number and you'll get a call back from Zoom. On connection issues, if you have a poor connection, if something freezes up, you can always try to log out and log back in. And the most important thing is the Q&A function for asking questions at any time during the webcast today. We encourage you to do that by selecting the Q&A icon and filling your question in. If you do, we appreciate your name and your organization so we have some idea where you're coming from. I will say that we'll do all the Q&A at the end of the presentations. And the other thing to note is that on Zoom, we will have the raise hand and chat features disabled. So only use the Q&A icon for today's webcast. Next slide, please. We have a great lineup of speakers, starting with Karen Ginsberg, who directs the CAHPS program within the Center for Quality Improvement and Patient Safety at the Agency for Healthcare Research and Quality. From the Centers for Medicare and Medicaid Services, we have Melanie Brown, who is the Technical Director in the CMS Division of Community Systems Transformation. Following Melanie will be Kathleen Woodward, who is a Managing Director with the Lewin Group, and Kathleen works on the HCBS CAHPS initiative under contract to CMS. And finally, we'll have Michael Carruthers, who is the CAHPS HCBS database lead at WestAt, and WestAt is the prime contractor to AHRQ for the CAHPS database. And again, I'm Dale Schaller, I'm a member of the CAHPS team and serving as your moderator. Next slide. So our agenda has three major parts today. We will begin by introducing the Home and Community-Based Services, or HCBS initiative, that's jointly sponsored by AHRQ and CMS. We'll also describe what the HCBS CAHPS survey is and how it works. And finally, we'll focus on the HCBS CAHPS database and the benefits and the steps for participation. And again, we'll leave as much time as possible for your questions and answers that we'll take at the end of the webcast. Okay, Karen, over to you.
Thank you so much, Dale, and welcome everyone to this webcast today. I'm so glad that you can join us to discuss the HCBS CAHPS survey database. AHRQ is hosting this webcast today, but this is, as Dale mentioned, a joint project of AHRQ and the Centers for Medicare and Medicaid Services. I'd like to just tell you a little bit about AHRQ, our agency, and our mission and our interest in the CAHPS program, as well as the CAHPS surveys, to start today off. So on the next slide, please. AHRQ's mission is to improve the life of patients by helping healthcare systems and professionals deliver care that's of high value, high quality, and is safe. And we're a research-based agency, a science-based agency, and we accomplish our mission by investing in health systems research to make healthcare safer, improve quality. We create tools for healthcare professionals to use to improve care for their patients, and then we generate measures and data to help track the performance of the healthcare system in the U.S. and evaluate its progress. The next slide, please. CAHPS stands for Consumer Assessment of Healthcare Providers and Systems, and this is about this is a program started and funded by AHRQ since 1995 to advance the understanding and the measurement and improvement and reporting of patients' experiences with their healthcare. And when we talk about patient experience, What we're talking about is whether something happened or how often something happened as reported by the patient. What happened to the patient in a healthcare encounter. And we distinguish patient experience from patient satisfaction. It's a very different metric. Patient satisfaction addresses how patients felt about their care. It's their feelings about whether they were satisfied with their care or not. So they're two very different concepts. The next slide, please. So the CAHPS program at AHRQ conducts research to understand patient experience, to understand how to measure it and collect CAHPS data, to report CAHPS data, and to conduct quality improvement using CAHPS data. That we are a full service patient experience research organization with a focus on the CAHPS surveys. What we are most known for is our the CAHPS surveys and related materials that help assess patient experience in healthcare settings and with health plans and providers. And we also, which we're talking about today, we also develop and operate voluntary databases for CAHPS survey data. The next slide, please. The CAHPS surveys are considered to be the gold standard for patient experience measurement. And again, they measure, as we just discussed, patient experience, not patient satisfaction. They capture the patient's voice in the development and testing of the surveys. And when we start a survey development process, we lead the process by asking patients or potential respondents, beneficiaries, whoever is the subject of the surveys, the respondent to the surveys, to tell us what's important to them to measure and to report. And that becomes the foundation for the domains on the surveys. We use a standardized methodology and research findings to develop validated and reliable surveys so that they can be compared across entities, plans or programs or facilities. So the CAHPS surveys are trademarked, and the trademark recognizes that the surveys, the CAHPS survey development has adhered to our design principles, and they ensure comparability across settings and plans, providers, and programs. The technical quality of the CAHPS surveys is overseen by what's called the CAHPS Consortium, which consists of the AHRQ CAHPS staff, our two funded research entities, cooperative agreement holders, RAND and the Yale University School of Public Health, and our contractor, Westat. And the next slide, please. So let me just quickly run down some uses for CAHPS surveys. CAHPS surveys are used in value-based purchasing programs. They're used for public reporting. CAHPS surveys are used in accreditation programs as well, as we've mentioned, quality improvement, and then generally for health services research. So with that, again, thank you for joining us today, and I'm going to turn the floor to Melanie.
Thank you, Karen. I am Melanie Brown, a technical director at CMS within the Division of Community Systems Transformation, which is in the Disabled and Elderly Health Programs group. Thank you for inviting me to present today. I'm going to start by sharing more about the Home and Community-Based Services, or HCBS CAHPS Survey. As a refresher, the HCBS CAHPS Survey was developed to support states with quality assurance and improvement, identify areas that need improvement based on the HCBS participant experience, and then allow the comparison of HCBS across states, programs, and populations. The HCBS CAHPS survey is the first Medicaid experience survey that has been tested and validated for use across HCBS programs and for all the different populations that are served through HCBS programs. So we're going to start by reviewing the HCBS quality framework because it really highlights the thinking and decision-making that informed the development of the HCBS CAHPS survey. Then we'll get into more specifics about the HCBS CAHPS survey itself. The three programmatic aims of the HCBS quality framework are to ensure the safety and well-being of people receiving HCBS, to promote high quality and accessible HCBS, and to promote value-based care and services for people receiving HCBS. These aims are achieved through certain actions, including measuring quality and outcomes analyzing data, tracking and trending data, internally and publicly reporting on quality and outcomes, detecting and responding to individual and system level problems, and promoting improvement in quality and outcomes. The hope is that by focusing on these areas with the programmatic aims in mind, we'll achieve improved experience of care, greater independence, health, well-being, self-determination, and community inclusion for participants, and more cost-effective and appropriate care and services. Next slide, please. CMS also identified 5 quality strategy elements that support the framework. The 5 elements are promoting development and use of standardized, validated, and meaningful quality measures, aligning, coordinating, and addressing gaps in federal and state measurement, reporting, and monitoring requirements, activities, and systems, developing, implementing, and supporting use and availability of a comprehensive set of quality improvement, quality assurance, and technical assistance strategies, activities, and tools, improving oversight and enforcement, addressing gaps in regulations and oversight and enforcement, and better supporting states to comply with federal regulations, policies, and guidance. And finally, supporting development, testing, and implementation of value-based purchasing and alternative payment models. Use of the HCBS CAHPS survey is well aligned with each of these elements. And you'll see that reflected as we discuss some of the key features of the HCBS CAHPS survey. Next slide, please. The HCBS CAHPS survey collects information from a person receiving HCBS about the extent to which the services they receive are person-centered, prioritize what's important to them, and the extent to which participants can direct and control their own plan and how the services are delivered. This is critically important feedback for states and programs to get, helping them to see how well their efforts towards adopting person-centered practices and approaches in service planning and delivery are working, and what kind of a difference it's making in the lives of program participants. Next slide, please. Now, this slide provides a quick snapshot of the key features of the HCBS CAHPS survey, which I'm going to briefly review now. The survey collects information about the extent to which the services the participant receive are person-centered, prioritize what is important to them, and the extent to which participants can direct and control their own plan and how services are delivered. Again, this is critically important feedback for states and programs to gather, helping them to see how well their efforts towards adopting person-centered practices and approaches in service planning and delivery are working, and what kind of difference it's making. The HCBS CAHPS survey was developed with input from a wide range of stakeholders and tested through the CMS Testing Experience and Functioning Tools program, with 9 states participating in that demonstration. At the conclusion of the TEF demonstration, the survey was formally adopted into the CAHPS trademark program. So use of the HCBS CAHPS survey comes with all of the benefits of being a part of that suite of tools. CAHPS is a trusted brand, familiar to providers, publicly available, and users have access to high level as well as one-on-one technical assistance as needed. Finally, the survey is applicable to field in both fee-for-service and managed care programs. This allows all the plans operating within the state to be compared to one another or aggregated to provide a picture of what's happening across the state. For managed care plans using the survey, they can measure the quality of their services across the state in which they operate. On the next slide, I'll elaborate on approaches that states, HCBS programs, and managed care plans can take in designing their survey samples, as these can vary based on an entity's objectives for comparison or aggregation. So the unit of analysis in this context is the unit for which the survey results will be produced and reported. The unit of analysis should, in this case, be the accountable entity. The accountable entity is the operating entity that's responsible for managing and overseeing the specific HCBS program in a given state. Although Medicaid HCBS programs are administered by state Medicaid agencies under various legal authorities, these programs frequently are operated by other entities such as county or other non-state governmental agencies or managed care plans. Because the accountable entity can vary, the unit of analysis may also differ from situation to situation. So at the conclusion of the TAP demonstration, round 1 of testing, 19 composite measures of quality that are derived from the HCBS CAHPS survey were endorsed by the National Quality Forum in 2016. Most developers put their measures through a rigorous process long before a consensus-based entity considers them for endorsement. A consensus-based entity performs careful review and assessment to gather input from stakeholders across the healthcare enterprise and develops consensus among those stakeholders, deciding which measures warrant endorsement. There are 4 criteria to assess a measure for endorsement. 1, is it important to measure and report to keep our focus on priority areas where the evidence is highest, that measurement can have a positive impact on healthcare quality. 2, is it scientifically acceptable so that the measure, when implemented, will produce consistent and credible results about the quality of care. 3, is it usable and relevant to ensure that intended users, consumers, purchasers, providers can understand the results of the measure and are likely to find them useful for quality improvement and decision-making. And is it feasible to collect with data that can be readily available for measurement and retrievable without undue burden? So through a collaboration between CMS and AHRQ, the National HCBS CAHPS database offers free access to aggregated results. CMS has also contracted with the Lewin Group to provide technical assistance to states, managed care plans, and groups interested in HCBS CAHPS. And I'll now turn it over to Kathleen Woodward with the Lewin Group to describe the available resources and technical assistance.
Great, thank you, Melanie, and sorry about that. So my name is Kathleen Woodward, and I'm a managing director with the Lewin Group. And I'd like to share and remind those that have adopted the HCBS CAHPS survey or in the planning stages of a few resources and technical assistance opportunities that are available to you. Next slide. So for more information, you can find a wealth of resources on the AHRQ CAHPS website and Medicaid.gov website. The links are all embedded within the slides that will be shared later. We have technical assistance documents that are available, such as a technical guidance document, frequently asked questions, example scripts for interviewers. The survey instruments are also available on the website in both English and Spanish, and there's many more as well. You can also get to this before the slides are shared just by typing and searching in Google CMS HCBS CAHPS Survey, Medicaid.gov. The resources also include some best practices for surveying, sampling, and improving response rates. And these TA materials were uploaded in 2021. You can also contact the HCBS measures at lewin.com for individualized technical assistance related to the HCBS CAHPS survey administration. And technical assistance is available to states, to managed care plans, and other HCBS CAHPS users. And we'll discuss in more detail the kinds of technical assistance on the next slide. So the Lewin Group provides technical assistance for the HCBS CAHPS survey through 2 main venues. So on the left, you'll see a description of the HCBS CAHPS early adoption work group. And then on the right is a description of appointment-based office hours that we've been hosting. So the early adoption work group is for interested states and managed care plans. And we invite those who have implemented the HCBS CAHPS survey or are considering the survey as an experience survey for your Medicaid HCBS programs to join this work group. The work group so far has met 4 times, and an office hours style event where more open Q&A discussion was held in January 2023. So the work group supports the adoption and successful administration of the survey across states. It also supports data analysis and data aggregation and participation in the HCBS CAHPS database, which you'll hear more about. It identifies and promotes best practices in the HCBS CAHPS survey implementation. So states and managed care plans are sharing their experiences directly with one another. And it also supports continuous quality improvement of these services. The technical assistance team is also available for these one-on-one type meetings, which we call appointment-based office hours, with interested parties to discuss the survey and answer questions on survey design, adoption, and implementation. We also talk through state approaches and the HCBS CAHPS database. So as you're preparing for submission, there's some technical assistance that's also available during these calls. We'll be sharing dates and times for these open office hours. You're also able to request one-on-one technical assistance at any time. So if you have questions related to the technical assistance or suggestions, we've included here the email address that we monitor, hcbsmeasures@lewin.com. And you can also email this mailbox if you're interested in subscribing to the HCBS Measures listserv. This listserv, we send out emails about information on upcoming events and registration information for future work groups, as well as these appointment-based office hours. So I'll turn it over now to Michael Carruthers at Westat to tell you more about the broader CAHPS database. Thank you.
My name is Michael Carruthers, and again, I'm the HCBS CAHPS database lead here at Westat, overseeing the data submission and reporting activities for the database. And I'll just talk a little bit about the CAHPS database and then also the HCBS CAHPS database specifically. The CAHPS database is the central repository of data for the health plan survey, the clinician and group survey, which currently has reporting data, but we have submitted new submissions. And as of early 2020, a repository for CAHPS home and community-based services survey data. The database is designed for two major applications. The primary purpose is to facilitate comparisons of CAHPS survey results by and among survey users to assess performance. And the database also provides de-identified data for research purposes. Participation is voluntary and open to all users, and this database is funded by the Agency for Healthcare Research and Quality and administered by Westat through the CAHPS user network. The HCBS CAHPS database specifically is a collaborative initiative between the Agency for Healthcare Research and Quality and the Center for Medicare and Medicaid Services. This database will facilitate comparisons of HCBS CAHPS survey findings by individual states and HCBS programs, and participation in this database is also free and open to all states and managed care plans on a voluntary basis. Our next data submission period will open in August this year and will be conducted August 7th through the 25th. Next slide, please. Some of the benefits of participation in the database are that any data submitter will receive a customized report that compares their state or managed care plan, individual program types of results to our overall HCBS CAHPS database results. And that data will also be included in other reporting products, which I'll discuss a bit further on an upcoming slide. And we also offer free technical assistance to data submitters and users of all of the reporting products. Next slide, please. As I mentioned earlier, the HCBS CAHPS database online submission system opens once a year in August. Organizations interested in submitting data just need to complete a few easy steps. Step one is we ask that you register for an account where we just ask for some general information regarding the state or managed care plan. Step two is the state or managed care plan needs to provide assigned data use agreement. And this just specifies how the data will be used and stored. Step three is prior to data submission, we request a copy of the survey instrument that was used. And that is just reviewed to ensure that it adheres to CAHPS standards. And we also encourage submitters actually to send in survey instruments prior to data collection if possible, just to ensure that it is compatible with the database. And then step four is the state or managed care plan's survey vendor needs to be able to provide a data file that has been formatted to the CAHPS database specifications. Next slide, please. This slide shows an example private Excel report that is provided to submitters upon request. The report shows how a particular state or managed care plan performed compared to the overall database averages. There are some items shown, such as the database average and significance test, that are dependent on the amount of data received to be included. Next slide, please. This slide actually, I'm sorry, actually was confused here a bit, but this slide is the private feedback report slide, and that shows that database average compared to the individual program types that we were referring to previously. And it shows that you can compare those scores to the overall database averages. And next slide, please. And this slide actually shows an example of how data may be reported on the AHRQ Data Tools website. An overall composite score and scores for individual questions that comprise that composite measure would be displayed. This is not actually live on the AHRQ Data Tools site as of yet. As I mentioned earlier, would be dependent on the amount of data that's received. Next slide. I just want to talk a little bit about data confidentiality. HCBS programs can be assured that their data are kept confidential and that no program names or other identifying information is ever made publicly available. Only aggregated program data is ever publicly reported. Next slide. As I mentioned earlier, the CAHPS database team at WestAd offers free technical assistance with data submission issues, responding to questions regarding data specifications, and just the overall data submission process. And we also offer assistance to any user with the public reporting products, such as use of the AHRQ Data Tools website and how to obtain and use the research data sets. The CAHPS database team can be contacted at the email address shown here, which is HCBS CAHPS database at westat.com. And the phone number is 855-580-4657. Thank you, and I think I'll turn things back over to Dale to facilitate the question and answer portion.
Okay, thank you very much, Michael and Kathleen and Melanie and Karen. I'm going to invite all of our presenters to turn your cameras back on for the Q&A. We've had a few questions come through during the presentations, but I want to advance the slide one more to remind you again how you can ask a question. We still have plenty of time remaining for our scheduled webcast. If you want to send us a question, type it into the box and then submit it, and we will do our best to field it. An interesting question come through the HCBS mailbox, the TA mailbox. Melanie, I'm going to toss this one to you. If there is or might ever be a long-term care or HCBS provider experience survey, any thoughts on that?
Yeah, it's an interesting question. I think certainly there are states that are doing some form of provider surveys with homegrown, what we would consider homegrown measures. And certainly I think across the different demonstrations at CMS, there are provider surveys. Typically, one that I'm thinking of right now under the Support Act, Section 1003, which is a capacity expansion demonstration program, which is aimed at expanding the capacity of providers who provide medication-assisted treatment to individuals with opioid disorders. They're certainly doing, I think, a provider survey, which is largely aimed at looking at whether the state's measures to provide training and technical assistance to Medicaid providers or potential Medicaid providers around sort of what's needed to help providers be better able to serve that population. But most of the provider surveys that I am aware of are sort of at that level. They're for a specific population of providers. I'm not aware at this time of a provider survey that specifically targets LTSS providers, but it's certainly something to think about and feedback that I can take back to our stakeholders at CMS.
Very good. Thanks so much. We had a question early on, and Michael, I think you've addressed this with respect to the availability of benchmark comparisons for looking at your particular HCBS survey scores. I just want to ask you to elaborate a little bit on when the CAHPS database chooses to actually make summary level data available. What are your threshold rules for the number of states that need to be included? Can you just address that and just remind everyone again about the timing and the availability of the chart book that you described?
Yes, thank you, Dale. Yeah, typically reporting products are available approximately 4 months after the data submission period. And as I mentioned during the presentation, it's highly dependent on the amount of data that was received. All submitters, regardless of the amount of data received, will receive a private feedback report. However, the chart book and some of the displays on the AHRQ data tools site are dependent on quite a bit more data. We're getting close to that. We said this was a new database that we've just started, but we're looking forward to being able to provide those products in the near future.
Very good. Thanks, Michael. I have a question either for Kathleen or Melanie related to guidance for selecting a survey vendor. Are there any requirements, first of all, that CMS has for vendor selection? If not, what kind of guidance can you give states or managed care organizations for choosing a vendor for the survey?
Sure, I think I can take that question.
Okay.
So use of the HCBS CAHPS survey is voluntary. It's not required or necessary to use a vendor to administer the survey or to submit survey data. The CAHPS database is open to all organizations that are able to follow the submission requirements. Currently, CMS is not approving vendors for the HCBS CAHPS survey. It is possible for the survey data to be collected by in-house staff of a state agency or other sponsor, or through a commercial survey research organization. Regardless of which approach is taken, there are basic competencies that must be present. For example, the data collection effort requires the data collection entity to have a computer-assisted telephone interviewing or computer-assisted personal interviewing capabilities. States themselves will need to decide how to accomplish the data collection, but there are two primary options: in-house data collection directly by the survey sponsor, for example, the state or other organization, or two, data collection performed by an external vendor under a contract with the state. In-house data collection for state survey sponsors may involve using existing state employees or existing HCBS program staff, or hiring contract staff. Data collection through an external vendor can involve contracting with the survey research center, as we said, like a university or a for-profit organization, or contracting with a stakeholder group. At this time, CMS does not have recommendations that are sort of CMS certified for programs or states that are conducting the HCBS CAHPS survey. And as a result, there's no standardized recommendations or trainings or approved survey vendors. It is advised that vendors who administer the survey are familiar with the instrument structure, the content, and intent, and be knowledgeable about the unique features of the instrument and implications for how it's administered.
Right. Okay, great. Thanks so much. Just pushing on a little bit further on some administration questions. Kathleen, I'm going to ask you to address a timing question. Audra Summers asks about when throughout the annual cycle is it wise or good to administer the survey. For example, the health plan CAHPS survey has a certain sort of field period that's recommended. Is there a sort of field period recommended for HCBS survey administration?
Thanks, Audra, for that question. So for the HCBS CAHPS survey, we've seen states field it throughout the year, so between January through December. One thing that states often need to consider, though, is are there other surveys that are in the field, so that not to have survey fatigue for the beneficiaries. Another thing to consider is the timing of when the HCBS CAHPS database and being able to submit to that for the previous year. And other considerations that we've been hearing about the timing is if there's any other reporting requirements that your state may have that you want to use the HCBS CAHPS for. Well, it's not a required or mandatory survey. The results may be useful for other reporting within the state. So there may be a report that you want to present to your legislature, or there might be an annual meeting that you have with stakeholders. And so thinking backwards from where you plan to present out the data and then when you'd want to collect the data is something we've also seen. So in one state, we've seen that they're in the field from in the fall. Another state, we've seen that they're in the field in the winter, and another is in the spring. So there's lots of different considerations for the timing that you might want to think through. And if you have specific questions, our team, all of those that are presenting, we all participate and join the one-on-one office hours. So we can always discuss that on a individual state or managed care plan level.
Thank you, Kathleen. So Michael, just to kind of build on that answer, can you sort of define it when the CAHPS HCBS database aggregates comparative data for a given year? Is that done on an annual basis, or what is the sort of beginning and end period for the comparison data that are produced through the CAHPS database?
Yes, as I think Kathleen alluded to, data is collected from the prior year's fielding or administration period. So for this year's collection, for example, we'll be collecting data from January 1, 2022 through December 31st, 2022.
Right.
And that data will be reported again, approximately 4 months after data collection.
Okay, and that timing question answers another one that came through in terms of when the data would be available through the public reporting process, through the CAHPS database. Melanie has a question with respect to requirements to make the HCBS CAHPS survey mandatory for plans that are seeking NCQA, LTSS distinction. Do you have any insight on that question?
So the short answer is there are no current plans to make the HCBS, to make use or reporting of the HCBS CAHPS survey mandatory.
Okay. Okay. Very good. Other questions that have come in, a few through registration that I'll turn to now. One is sort of broad, and I'll toss this to either you, Melanie, or Kathleen, just in terms of, I've collected my data, I've got my HCBS CAHPS survey data, I've got some comparisons now through the HCBS CAHPS database. What kinds of guidance or strategies might you be able to provide for improvement, interventions, or how can states and managed care organizations begin to think about improving the quality of HCBS services supplied to their beneficiaries?
So I'm happy to start. So I think one thing that the HCBS CAHPS, use of the HCBS CAHPS survey allows you to do, because it is across sort of populations and can be used across HCBS programs, is it allows you to identify where there may be areas that need more attention. So we're all dealing with sort of competing priorities and making decisions about sort of how to allocate resources and how to allocate funding. So if we're finding that there's a particular group or population where we're seeing lower scores, and it's a trend, it's a pattern, there is the opportunity to sort of really focus and hone in on that group. So I think that's sort of the first step, sort of figuring out where we need to be addressing continuous quality improvement efforts. I would also say that depending on what the issue is, we do have technical assistance available. So there may be technical assistance that can be targeted once we identify sort of what the issue is and sort of why we may be seeing trending low scores in a particular population or program. I would encourage the user, the state, the accountable entity to pursue technical assistance to figure out how we can better address, how we can use these results to inform our continuous quality improvement efforts. And Kathleen, is there anything that you would add to that?
Yeah, I think one of the other things to think through is states might be at different places in their implementation. So a state that's in the early stage looking at just benchmarking the data might have a different kind of hypothesis or what they're looking at than a state that's further along and that's been using the survey for 5 years. And so I think when you're meeting with your stakeholders or even just with your state or managed care plans internally, thinking through that longer term plan, okay, what's our outlook that we're looking at, or the quality improvement that we're focusing on in the short term? Maybe let's benchmark it, see where we're at. Then year 2, we see, oh, there's been this change in some of these certain areas, kind of like what Melanie was talking about. But then maybe when you're 5 years out, you're looking at something a little bit different. And so that's just thinking through kind of what you're predicting, but also then looking at the data and seeing what's it telling you and being able to pivot and flexible with kind of some of those results.
So, and Dale, I just wanted to add one other thing. The other thing I think is potentially helpful and something that is, I think will be eventually available through the database, is that by the sharing of data may also allow you to do some peer-to-peer learning, to reach out to other states who may be performing well in an area where you see struggle, and figure out sort of what they're doing that you may be able to learn from and to inform your continuous improvement efforts.
Yeah, that's a great point. Thank you both for those very helpful responses. So, Michael, I'm going to ask you, so this idea of using the CAHPS database for comparison purposes and identifying potential opportunities for improvement. One question came in apparently from a state that participated early on in one of the sort of early adoption periods of the survey, may want to sort of look at their data now compared to the more current data in the CAHPS database. Would there be any opportunity for that state to receive some sort of feedback report, or is it necessary for them to submit more recent data for that purpose?
Yes, excuse me. Unfortunately, it would be. The private feedback reports are really provided to current submitters to the database. So you would have to be a current year participant in order to receive that report. We would not have the ability to provide you an updated report otherwise.
Okay, good. Thank you. The question here from Susan Reitzman, who asks, can HCBS CAHPS be used by programs for beneficiaries receiving self-directed HCBS services? And if not, is there any effort to address this? Melanie, is that something you'd like to address?
Sure. There are actually questions within the HCBS CAHPS survey that specifically address self-direction, the ability of the participant to direct with the services. So yes, it would be appropriate to use within programs where self-directed services are being received.
And just a kind of another related question that came in through registration about HCBS CAHPS is a long survey, and it's got a lot of questions. You reviewed the various domains that are covered. This person asks if it's possible to add other questions, custom questions to the survey. What kind of guidance do you have for that? Melanie?
So there is a specific section where you can include questions, but I say this because it is very structured. It's a very structured survey with the CAHPS trademark. It's important to do this in the way that it is advised in the instruction booklet, because changes that aren't supported can affect sort of validity issues and your use of the CAHPS trademark. So the short answer is yes, but I say that with the caveat that I would encourage you to look carefully at the guidance on how this is done and where it's permissible to add questions.
Right.
And I can add to that too. So it's before the about you section. So it's where we get into the demographics that the state specific questions can be added. And just that if you are adding any state specific or other specific questions, to make sure to reach out to the HCBS measures at lewin.com and also HCBS CAHPS database at westat.com, so that we can make sure that it's added in the right place before you go out into the field. Because if it's added in the wrong place, it could impact how you do the database submission. And so you just want to make sure up front everything's kind of dotted all the I's and crossed the T's.
Yeah, I think that's a great point. So there is opportunity. I'm just going to sort of recap to do a little bit of customization, but there are certain rules that need to be followed. And as a general rule, what we're learning is it's very helpful before you go into the field, if you have any questions at all about the comparability of the survey instrument you're using, please send that either through the TA line to Lewin or through the HCBS CAHPS database TA line that we'll talk about at the very end, so that we can sort of look at those issues up front and make sure that you don't have some issues down the line that could have been avoided through that prior review process. Okay, Michael, a couple more questions for you. You've talked about the various reports coming out of the CAHPS database for HCBS, the chart book, the private feedback reports. Any cost associated with those reports?
No. I'm happy to say that the private Excel reports are made available to submitters free of charge. Access to the AHRQ Data Tools website, the chart books, and the de-identified research data sets are also free of charge. But again, as I talked about earlier, production of these products is really dependent on the amount of data contributed. So we really encourage states and managed care plans to participate if possible.
That's really good. That's a really important message. We have a lot of people who are participating in today's webcast, a lot of users of the survey, a lot of potential users of the survey. The more widespread the implementation of the survey is, the more information will be available for all of the things that it's designed to address, whether it's improvement or just understanding exactly what's going on within your populations. And then the submission of the data to the database will allow us to make a much more robust set of comparative data for all of those potential uses. One more question just to before we leave the database again, Michael, is you mentioned the research data sets. Can you just give a couple examples of how the data sets for research purposes can be used or have been used in the past?
Sure. The approved research database purposes include mostly dissertations and research for quality improvement and or white papers. When someone requests a research data set, we actually ask that you complete a summary form that states the research need or question, the methodology, and how you intend to use the data. And we here at WestStat do triage those requests with their approval actually by the Agency for Healthcare Research and Quality. So it's a little bit of a process that typically can take up to 30 to 45 days.
Mm-hmm. Do you have a question here that comes from Dennis Heafy? I'm not sure I got your name right, Dennis. I apologize. You've reframed a question that really sort of addresses the content, as I understand it, of the HCBS CAHPS survey, and to the degree, and I'll let this be a question for you, Melanie, or Kathleen, if you want to deal with this. How does the survey itself capture the way in which these state and health plan programs serving beneficiaries protect their ability to choose and their dignity and their sort of self-control? And so I guess I think it gets at issues of kind of consumer protection and understanding the need to sort of honor the individual sort of independent living model within HCBS. Kind of a interesting question. You want to try that one?
So Kathleen, did you want to take this, or I can start and you can weigh
Yeah,
in?
if you want to start and I can jump in.
So I think if the question is whether or not there is content within the HCBS CAHPS survey that addresses issues like health and welfare, safety, yeah, the answer is yes. I think the part of the question I'm struggling with a little bit is whether or not it specifically, how did you say it, capture? So I think it does capture whether or not the accountable entities are providing services in which the beneficiary is feeling safe and protected and able to direct their own services. But I read the first iteration of the question, so I'm not sure if we're actually answering the question that you're asking, but
Well,
the content I think is certainly there. And Kathleen, what would you add to that?
Yeah, I think the content is there. I also would say that in developing these questions, stakeholder groups were engaged, consumers, members, family members of the beneficiaries were engaged. And so I do think that that perspective was considered. And that's something that can always be looked at again if there's new and other commentary to add to the conversation. The other piece would add is that proxies are able to respond on behalf of the beneficiary. And also there's concerted efforts to make sure that the case manager or the other person that is that the member is responding about the services being received from them, that they're not the ones administering the survey. And so I think that also helps protect the consumer choice, their control, and kind of their dignity of the services that they're receiving.
Right. I think you both handled that very well. Thanks so much. And I hope it was helpful to the questioner. Michael, I'm going to come back to you just for a quick sort of further explanation. We talked about public reporting and the threshold. The question is from Susan Reitzman again, in terms of how many HCBS programs and/or states are currently submitting to the CAHPS database. Can you quantify it at all at this point, and how it's kind of grown in the last couple of years?
I can say that it has grown, and we're definitely progressing and getting closer to producing, I think, all of the reporting products that we've mentioned previously. But I cannot get into specifics of who or which programs have submitted to the database, because it just violates our data use agreements that we have with submitters. So I can't get into those specifics, but I can say it has grown quite a bit, and we look forward to it continuing to grow.
Great, thank you. This is a really interesting question, Kathleen. I'm going to direct to you regarding. We have talked about the entities administering the survey being states or MCOs, sometimes MCOs on behalf of states. The question comes from Melissa Stalker and asks, can companies, quote, companies implement and participate even if their state isn't currently involved? And I assume the company is a reference to maybe an HCBS survey provider eligible to use the survey.
Yeah, I would say we blanket use state and managed care plans because those have been primarily the ones that have been submitting to the database, but there's no restriction on who can use the survey. It's offered and available by CMS for free. The cost is to the person or the entity that is overseeing implementation of it, where you have staff time to actually administer the survey, staff time to enter the data, analyze the data, but there's no restriction that I'm aware of about companies that are implementing it or can participate if their state's not. So state is also used loosely. You may have one waiver using the survey and we classify it as, quote, the state is using it, but it may not be broad across all of the waiver programs within a state.
Right. Thanks very much. I'll just reinforce the idea that all of the CAHPS products that are supported by AHRQ are in the public domain and they are free for use. We just, ask that the use of those surveys are done in sort of along with the guidelines that we recommend. And if you do use it, please do let us know so that we can see if your data that you're collecting would be eligible and appropriate to include in the database. Okay, here's an interesting question in terms of administration, and Melanie or Kathleen, you might want to address the idea from Maria Rivera, who's wondering, as technology advances, is there any thought that the survey itself could be self-administered, and how would that might work? Do you have any thoughts on that question?
Sure, and this comes up often, and I think we completely acknowledge that a self-administered survey would be easier, less costly, and perhaps more efficient to administer. But there are some, I think, some definite questions about whether or not that is what makes the most sense in terms of being able to assess HCBS beneficiaries' experience of care. One of the issues with self-administration, especially if it's web-based or it's not really possible to know definitively if it's the beneficiary who's actually completing the survey, and that's a critical concern when we're talking about experience of care. So I think at this point, CMS has not been willing to move forward with a self-administered experience of care survey in this manner. That doesn't mean I think that there aren't other things that could be assessed in a self-administered way. But I think for HCBS CAHPS survey at this point, CMS is not looking in that direction.
Very good. I think we've reached the point where we're going to have to kind of move to wrap things up. There's questions or comments I want to review before we end. Can you go to the next slide, please? So there's a way to stay in touch with CAHPS and the CAHPS program, and specifically the CAHPS database. And one way to do that is to sign up for email updates. And the way to do that is to go to the AHRQ site, ahrq.gov, and you select in the upper right email updates, and that allows you to select in a drop-down menu receiving information routinely on things related to the CAHPS program, news and events, updates, announcements of forthcoming webcasts, submission deadlines, and other products and services. So we encourage everyone to be signed up for that free alert service through AHRQ. The next slide reviews ways in which, if we didn't get to your question, or if you have other thoughts that occur to you after the webcast ends that you'd like to pass along, 3 ways to get in touch with the CAHPS database. So through email at HCBS CAHPS database@westat.com. The toll-free number is 1-855-580-4657, and the website, which has a lot of information, is the URL is shown here. That it's www.CAHPSdatabase.ahrq.gov. So with that, let me thank you again, Karen, Melanie, Kathleen, and Michael, for your excellent presentations. A lot of information got provided today. If you do have any questions that didn't get answered, please submit them through one of these 3 mechanisms. I think that covers everything, other than to say thank you all for joining today, and have a great rest of your afternoon.